what is the grievance system and what rights the grievance system affords OHP members. So in this presentation, we'll see what the grievance system is. It's comprised of 3 parts. There's the complaints section, and there's the appeals, and then there's the administrative hearings. And then we'll also identify where you can call if you need help with any of these 3 sections. The grievance system is here to protect people who have Oregon Health Plan or Medicaid coverage. And this is true for all levels of Oregon Health Plan coverage, from emergency services only to adults, children, pregnant women, and also those that have dual coverage, both Medicare and Medicaid coverage. The reason for the grievance system, as an agency, if we do not hear from you or we do not get complaints or appeals or hearings requests, we won't know that there are any issues or any problems going on. It is the Oregon Health Authority's job to help you get the care that you need. So this system allows us to make the Oregon Health Plan better.
Jaime, just one quick thing. We can see your PowerPoint. We can see the slides, the different slides. I'm not sure if you can enter full mode. Just wanted to let you know.
Okay. Yeah, that's gonna be okay. Just a moment. Okay, I hope that's a little bit better.
Yes.
Okay, so the grievance system is an important part of client rights or Oregon Health Plan member rights. In the member handbook, Oregon Health Plan members have many rights, and this is one of those. Again, the 3 parts to the system are complaints, appeals, and hearings. And you can find more information in the Oregon Health Plan member handbook on pages 33 to 35. If you go to the link that's on this slide, you can find the Oregon Health Plan member handbook in many different languages. The 3 parts of the complaints and grievance system, again, the first part is complaints. This is defined in state and federal law as any expression of dissatisfaction. And I'll show you a few examples here coming up in the next few slides. And the appeals have to do with the request that's made for coverage of services. So this will be made either directly to the Oregon Health Authority or to the coordinated care organization a member is enrolled with. Once a request has been submitted to them for services like a surgery, if it's denied, you can request an appeal. After the appeals process, there's also the process of an administrative hearing. If a coordinated care organization on appeal continues to deny a requested service, the member can request an administrative hearing at the state level. The Oregon Health Authority has hearing representatives that will review the appeal that was done by the CCO and proceed to a hearing if necessary. So complaints. What type of complaints do folks submit to not only the coordinated care organizations, but also to the Oregon Health Authority? There are a few that are here listed. One is my dentures don't fit. Another could be they can't find a doctor. They can't find a specialist that they were referred to. My doctor does not have interpreters in the office. So when I show up to my appointments, I have a hard time understanding and they're not providing me with an interpreter. My medical transportation is late again. So medical transportation to appointments is a covered service. But when there's a problem with that service, again, arriving late or, that can impact the patient because their appointment could be canceled. or the clinic may refuse to see them in the future because of late arrivals. So those are types of things that folks can complain about or submit a grievance or complaint, because it's not a specific service that they're asking for. It's the way that service was provided. It wasn't provided adequately. And so that's what the complaint would identify. What is the problem with getting these services? Are they working? So it's quality of care and access to care. I cannot get mental health supports that I need. So again, these are some complaints that we hear not only in our office, but we hear from the CCOs as well. And we want to hear about them because, again, if we don't know something is broken or something isn't working correctly, then we can't fix it. If you don't know which CCO you're enrolled with, the link on this page will provide contact information for all the CCOs throughout Oregon. Depending on the county that you live in, will limit you to the options that you have for CCO enrollment. And if you need additional assistance to figure out who your CCO is, or if you're even enrolled in a CCO, you can call the Client Services Unit at the number here, 1-800-273-0557, and they can provide you that information. They can also take a complaint or grievance, help you submit that form, or take it over the phone, and they will work with your CCO on complaints and grievances as well. What to expect when you submit a complaint or grievance. The coordinated care organizations, they have 5 days to respond to your grievance or complaint. So once you've submitted that, they have to send you a letter. They've either identified and resolved it, or they need to let you know they're going to need more time. So again, anytime that a grievance or complaint is submitted to a CCO, they have to respond within 5 days. And again, if they can't fix it in those 5 days, the letter must state that they will take up to 30 days and no longer than 30 days to resolve it or investigate it, and you should receive a letter of complaint resolution. In that letter of complaint resolution, if you're not happy with the outcome or the resolution that they came up with, 2 phone numbers are on that letter. One is for the Client Services Unit that I mentioned before, and then the other number is to our office, the Oregon Health Authority Ombuds Program. And you can call either one of us to further look into the resolution of your complaint or grievance. The second and third parts of the grievance system are the appeals and the hearings. So they're a little bit different. As you can see in the columns here, your doctor may sometimes need to ask for approval from the Oregon Health Plan or from the Coordinated Care Organization to provide surgery, medication, or some other kind of care. So these are known also as prior authorizations. So when that's submitted, the Oregon Health Authority or the Coordinated Care Organization have to respond. Are they going to cover the service? Yes. Or they are not going to cover the service? No. And when they do that, they have to send you a letter in writing. If the Oregon Health Plan or your Coordinated Care Organization, again, disagree or deny the service, you will get a denial notice known as a Notice of Adverse Benefit Determination. And you don't have to memorize what these terms mean, but it's in essence a denial notice. It'll be a letter explaining why the service is denied and the rules around that denial. The other piece to that letter are your rights. You have a right to appeal to an administrative hearing. You have the right to appeal that denial or go to an administrative hearing, depending on one of 2 situations. If you are enrolled in a CCO, Coordinated Care Organization, you have 60 days to appeal that denial directly with the CCO. The CCO must be given that second chance to take a second look at why they denied a service. After that appeal, you're going to get a notice of appeal resolution, which will then give you administrative hearing rights, which is the last step. The 60 days to appeal does not apply to persons that are not enrolled with a coordinated care organization. So this is also known as open card or fee for service. So if someone is open card or fee for service, they skip the appeal step. They go from a denial straight to an administrative hearing. So the last column on this PowerPoint is that the last step, which is the hearing process. So if you get an appeal resolution that says we're still not going to cover this by your coordinated care organization, or you get a letter from the Oregon Health Authority because you don't have a CCO and the Oregon Health Authority is denying a service, you have the right to an administrative hearing. So this means that, again, at the state level, someone will review the decision that was made to determine if it was made appropriately within the Oregon administrative rules. In any part of this process, the Oregon Law Center offers assistance with appeals and hearings, and only they can determine what they're going to help with, but they will listen to the case to determine if there's any type of assistance that they can provide. They do this through the Oregon Public Benefits Hotline at 1-800-520-5292. And they also have a website for additional information. Where to call with questions, concerns, or a complaint. So the first door should always be your coordinated care organization, if that's who you're enrolled with. Coordinated care organizations or plans, some folks know them as a plan, are different ones are Pacific Source, Columbia Pacific, Trillium, Health Share of Oregon, Eastern Oregon Coordinated Care Organization, Jackson Care Connect, and so that's just to name a few. Again, they cover different regions of the state. The link on this slide will show you the list of all the CCOs and their individual contact information. If you need assistance with filing with a question or concern or to file a complaint, you can also call the Client Services Unit at 1-800-273-0557 because they can direct you to the right CCO. They can give you a bit more information. They can even send you some forms if necessary. And then ultimately, again, if your problem isn't resolved, you can always come to the Oregon Health Authority Ombuds program, and I'll explain a little bit more of what we do. Ombuds or ombudsman. It derives from a Swedish word that means representative of the people. Sorry about that, my slides are jumping around. So again, the ombudsman is a representative of the people. In Spanish, it's defensor del pueblo. In Arabic, it's defender of injustices. Oregon revised statute, or through the Oregon legislature, has set up the Oregon Health Authority Ombuds program as an advocacy program. So we're here to advocate specifically for those that are on the Oregon Health Plan. Why an Oregon Health Authority Ombuds program? To serve our members. Again, to serve the Medicaid population that exists here in Oregon. Ombuds, we walk alongside Oregon Health Plan members. We try to step into their shoes and understand their care challenges. How can we better serve this individual? Is it finding the right mode of transportation? Is it finding the right type of provider? Maybe they need a provider that speaks their language. We elevate the member voice and experience to inform policies, programs, and operations. So once we've helped the person, we take that experience, and within Oregon Health Authority, we show how the policies, programs, and operations that are developed affect, what is the end result? Is it working? Is it not working? And what changes might we need to make? We reconnect the member with those equipped to meet their needs. So again, the first door should always be the coordinated care organization, because they're the most equipped to serve the members' needs in the regions of the state that they serve. They offer care coordinators, they have a network of providers, and they have many community partners that work with the coordinated care organizations. So if it's something that we can do, if we can't do, we connect them back to their CCO and work with the CCO, again, to ensure that the person has everything they need for the care and health. And we partner with other Oregon Health Authority offices, such as Public Health, Oregon Health Authority contractors, Oregon Department of Human Services, and community partners to support improved health and improved patient experience. So we are collaborators. We work with anybody and everybody that serves the Oregon Health Plan Medicaid population here in Oregon. Again, to make those connections, find resources, and get folks the care that they need. How to contact the Ombuds team. You can call us toll free at 1-877-642-0450. It is a toll-free number. At this time, it is only a message line, but the messages are checked throughout the day and assigned daily to, again, the 6 ombuds persons that we have on our team. You can also reach us by email at oha.ombudsoffice@dhsoha.state.or.us. That is the direct way to reach us by email. You can also send us a secure email if you find us online or click on the link that's here in the slide. You can get to our website that will give you access to a secure website to submit secure information. Sometimes if folks want to submit sensitive information, they can do so through our secure website. Anybody is welcome to contact us. Again, our goal is to serve the Oregon Health Plan population, and we've received requests or concerns or questions from providers that serve this population, community partners that work with this population. We've even had requests from coordinated care organizations on how we've resolved an issue or how we might be able to help a member that may be moving from one part of the state to another, or they just need that assistance, that just technical assistance that we may have to help them resolve an issue. So anybody and everybody can reach us at the contact information on this slide at any time in regard to any OHP or Oregon Health Plan concerns. We also are a no wrong door. If it's a Medicare related issue, that's not our, we're not specifically called out to serve those that only have Medicare, but we can get them connected to the right people to get their questions answered. So that's just an example of, if it's not us, we will find the right place for you to get your questions answered. Well, Fabiola, I think that's all I have